everyone, I am SHERRYLIN and today I'm going to present about my research project titled Predicting the Effect of Medical Fake News Related to COVID-19 on Users' Habit Change. So, this is the presentation outline, which I will start with background study, problem statement, proposed solution, objective, research methodology, result, contributions, and conclusion. This is the background study. In this pandemic, people are exposed to news that are related to COVID-19 very easily due to the existence of the social media platform. Therefore, I believe that misinformation and myths on medical fake news that are related to COVID-19 are spreading rapidly. Therefore, I have decided to carry out the project to prevent this problem to increase. Next is problem statement. There are several problem statements in these studies, which are first, fake news related to COVID-19 are spreading rapidly, which this could cause the society to believe the grapevine without searching for the truth of the news. Second, people are tend to share and expose to the false messages that are related to COVID-19. These people are coming from different background and different demographic, which they have different age and ethic, and they also got different opinion on certain news that they receive. And third, fake news could cause public distress, which people are exposed to fake news and they become gullible and naive, and this could make people tend to make an action that are out of their control. These are the proposed solutions for this research project, which consists of two diagrams, which first focus on the factors of using social media, and second, diagram on trait plus F model, which focus on awareness on misinformation. The objective of this project are first, to classify COVID-19 fake news from the existing dataset. Second, to identify the factors of using social media to find information related to COVID-19. And third, to find users' habit change toward using the social media to find information related to COVID-19. For the research methodology, there are several methods that are using in this research according to its part of the study. So first, on COVID-19 fake news classifications, a topic modeling method will be using, and second, factors toward using social media, and third, users' habit change toward using social media. These both objective will be using empirical method and quantitative analysis. So these are the several methodology that we'll be using in the objective 1, which are first, text analytics, second, LDA modeling, and third, clustering. And these are the methodology that we'll be using in objective 2 and 3, which are empirical study and quantitative method, which objective 2 are focusing on factors that are affecting users to use social media to find information, and third, which are focusing on trait plus F model on awareness on misinformation. Next is data collections and result. These studies consist of two parts of study, which are first, COVID-19 fake news classification, and second, factors in user habit change toward using social media. So in this first part of the study, COVID-19 fake news classification, the existing dataset was used, which are collected from the GitHub, and it is titled COVID-19 Healthcare Misinformation Dataset. This dataset was collected on 5th January 2020, and this dataset consists of two datasets, which are fake news and real news. And so the total of fake news collected are 572 and 1,230 real news that are collected. So these are the results for fake news classification, which LDA modeling, which are illustrated by PY-LDA model. And for the second part of the study, which are factors and users' habit change toward using social media, a survey was conducted using Google Form on March 2021, which are within 3 weeks, and this survey was distributed randomly through social media such as Facebook, Instagram, Twitter, and also messaging apps such as Telegram and WhatsApp. The questionnaire was designed into two parts, which are first, factors toward using social media to find information and news related to COVID-19, and second, awareness on misinformation related to COVID-19 information or news. Therefore, these are the demographic data from the respondent, which most of the respondents are female, and the age of the respondents are mostly 24 and above, and the employment status are mostly from student and employed. For discussion and finding for part 2, based on the survey conducted, we found out that factors that are affecting the users to use social media to find information that are related to COVID-19 are DSR, which are deficient self-regulation. Second, habit of using social media. Third, social media literacy. And fourth, security. There are several contributions that this research project contribute, which are first, news classification using topic modeling, which I believe future researcher could use this news classification in classify the news that are related to other health misinformation such as obesity, cancer, heart disease, and so on. And second, I also believe that future researcher could also refer to the proposed research model from Objective 2 and 3, where they could further study in user habit change toward the misinformation related to other health misinformation. Therefore, in conclusion, even though these studies provide insight into factors affecting the users in using social media to find information that are related to COVID-19 and also creating an awareness toward misinformation, however, there are several project limitations in this finding, which are first, in this study, we are using the existing data set from the previous work, which are, I believe that future researcher, it would be better if they could collect the data set within a long period of time, and it will be good if the data set are up to date. And second, in this study, we are focusing on COVID-19 misinformation, which I believe also the future researcher could focus on the other health information such as heart disease, cancer, obesity, and so on. Other than that, the sample size that are using in this research also are too small, which I believe that future researcher could collect more sample size, and as well as this questionnaire are randomly distributed, which are, it is not specified into a certain group of the people, which are, maybe we can focus on frontliner, on how they think on the fake news that are spreading that are related to COVID-19. Thus, it is important for next future researcher to discover and study more on these limitations of this study finding.